In this lecture, we're going to continue our coverage of Unit 3 on exercise testing and prescription principles by focusing on the graded exercise test. And this information is based on Chapter 5. Now, the graded exercise test is part of the overall examination of a patient by evaluating the onset, if any, of various signs and symptoms during an exercise task or a physical activity task. The graded exercise test, or also referred to just simply as the GXT, is typically ordered by the physician, and a number of items are typically evaluated. In terms of the subjective feeling by the patient, any chest discomfort that becomes evident, that is reported by the patient, will accompany the increase in physical activity. The personnel are also looking for cardiac-like symptoms, and all of these, in addition, these two bullet items, in addition to other factors that we'll discuss in this unit, will assist in the diagnosis of coronary artery disease. The personnel are also looking for a condition referred to as angina, and angina refers to chest pain, but is specific to the development of chest pain that's caused by a reduction in blood flow to the exercising heart. And these, in addition to other procedures, will identify the future risk to a cardiac event or provide a prognosis for the patient's condition. And what we see here in this graph on the right relates to the exercise capacity, or rather exercise tolerance, of a patient during an exercise test. And so as we move from the left to the right on the x-axis, here we see an increase in what we defined in a previous lecture as the metabolic equivalent. And the metabolic equivalent, the higher the value, the more intense the patient is able to tolerate the task. And the metabolic equivalent, as you can see here for both men and women, are predictors of mortality rate in an inverse manner. So those patients that were able to tolerate greater and greater workloads during a graded exercise test, or a GXT, have a lower predictive value for mortality rates, and these are normalized values, indicating that the patients that have a higher physical capacity have a better prognosis moving forward. However, the personnel must be acutely aware of various what are called contraindications for the GXT, and these are situations where the performance of a GXT should not be carried out. And there are two types of contraindications. The first are absolute contraindications, and these are factors in which the risk to the patient's health is far too great for any value that can be obtained from the GXT. And these include a wide range of different conditions, such as abnormalities that are detected on a resting electrocardiogram reading, or ECG. A patient that has been diagnosed with unstable angina, decompensated heart failure, which is a situation where under a resting case, the patient is experiencing a worsening of their signs and symptoms that is related to their heart failure. Patient that has been diagnosed with severe aortic stenosis, and so in this particular condition, the patient's aorta is abnormally narrow, and if it's abnormally narrow, the support of the heart and the rest of the body to the provision of blood flow would not be available because of that lower lower diameter aorta. Any patient that is experiencing acute myocarditis or pericarditis. And so what these are two conditions that are defined as the inflammation. Myocarditis is the inflammation of the muscular component of the heart, or pericarditis, which is inflammation of the outer layer, the outer sac of the heart, the pericardium. And so any patient that is experiencing an acute or immediate onset of these conditions should not be put through a GXT, or patients that are experiencing any existing acute infections, not necessarily to their cardiovascular system components, but just simply acute infections are absolute contraindications. The second type of contraindication is the relative contraindication, and these include a range of different conditions that raise concern, and before a GXT is to be performed, further evaluation must take place. And these include conditions such as left main coronary disease, arterial hypertension at rest, so a patient that has been diagnosed as having high blood pressure under resting conditions, a patient that has either a very high resting heart rate or an abnormally low resting heart rate. A patient that's been diagnosed with some other type of metabolic disease that is not under control requires further evaluation before a GXT is performed. And a patient that is afflicted with some sort of chronic infectious disease should not be put through a GXT unless they've been cleared through further examination. So once again here, the major difference between the absolute and the relative contraindications is that in the absolute case, the patient should not be put through or must not be put through the GXT, whereas with the relative contraindication, the patient may go through a GXT provided that these conditions are further evaluated and the patient has been cleared. In preparing for a graded exercise test, this will involve a number of personnel, and not just one individual. And the American Heart Association provides such guidelines for conducting an exercise test. And the personnel must be able to safely supervise the clinical GXT. The personnel must be appropriately trained and possess a range of different performance skills, and usually this can be confirmed through various levels of certification, and these can be obtained by the American College of Sports Medicine. In terms of the certifications, the personnel should include the exercise specialist, cardiovascular technician, as well as an exercise physiologist, a certified exercise physiologist. Now, for the personnel involved, there are a number of key skills that are needed. The personnel must first and foremost have a knowledge of those absolute and relative contraindications outlined on slide number 3. The personnel should have the knowledge and have a general understanding of what's called specificity and sensitivity, and these two relate to the quality of the various procedures that are being carried out in being able to either detect the presence, of a condition or to rule out the presence of a condition, and be aware of the predictive value of both positive and negative testing. And this leads into the third bullet item, in that the personnel should be aware of what are called false negatives or false positive tests. A false negative test is one in which the existence of a potential condition would be ruled out when the patient would actually have that condition. Alternatively, a false positive test is one where a patient would be assessed or diagnosed as having a particular condition when they don't actually have that condition, and can lead to inappropriate treatments. The personnel should have an understanding of the different protocols and exercise modalities that are available, and based upon the patient's profile and their needs, to select that correct protocol and modality specific to that patient. The abnormal responses that some patients may display during various parts of the graded exercise test should be known, and the personnel must have the ability to respond quickly to various signs and symptoms and be able to distinguish between those various signs and symptoms that may arise during the GXT. Being aware of those signs and symptoms, knowing when the graded exercise test should be terminated is another critical component for the personnel, and being able to detect abnormal electrocardiograms or ECGs during the graded exercise test is certainly necessary here. So the personnel must be able to read the ECG in real time as the patient is undergoing the exercise test. And a manual skill, in some sense, is that the personnel must be able to measure blood pressure accurately and reliably when the patient is resting and during exercise. The exercise period does pose a challenge to measuring blood pressure because the patient is actually moving, and so the personnel must have the manual skill to continue to measure blood pressure even though the person's arm may still be moving. So this ends our first portion of our Part 2 lecture on Unit 3.